The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, welcome to Wonderfully Made. My name is Dr. George Guthrie. I'm the Medical Director at Lifestyle Center of America. We're here today to talk to you about type 2 diabetes. We've learned some things from those people that we treat for type 2 diabetes at Lifestyle Center of America, and we think you'll be interested in them. Joining me is Dr. Tim Arnott.
Thank you, George, and it's nice to be here on
Yes.
Wonderfully Made.
Well, Tim, when we talk about diabetes, sometimes we get stuck as doctors in just treating the symptoms.
That's correct.
One of the things I enjoy about being at Lifestyle Center of America is we actually deal with the cause of the disease.
It's a very rewarding practice that we have at the Lifestyle Center of America, because individuals come and they've actually been down the other road. They have had their symptoms treated. They've become frustrated, and now they're very receptive to hearing how they can remove the underlying cause of their condition. And so they're listening, and they're ready, just like a sponge, to absorb all the information that the Creator has for these individuals.
And when they're ready, we can put them to work dealing with the underlying cause. Now, to help you understand as listeners what we're talking about, I suppose we need to explain a little bit. You see, to put it in a nutshell, we understand that type 2 diabetes is caused by taking too much energy in and not expending enough energy. And our body develops a resistance to the insulin in our body, and the blood sugars start to go up, and then the problems come from that. Well, they come from both the high blood sugar and the high insulin levels. So the diet and the exercise changes bring a change in the underlying cause. That means people actually need less medication.
That's absolutely right. And in fact, what we have to share with you on this program is, we think, very exciting. In fact, the data that we'll be sharing was actually presented at some national meetings, the American Dietetic Association. They actually had a total plant-based diet or a vegetarian breakout session, and the data presented at that session came from patients who were doing something a little differently. And it wasn't the traditional diet therapy that was used initially for type 2 diabetes. And also type 1 diabetes, which was a high-fat diet. And it wasn't a high-protein diet. It was another kind of approach. What kind of an approach was that, Dr. Guthrie?
Well, we've discovered that a diet that focuses on plants. Now, sometimes we say complex carbohydrates, but what we really mean is plants, where the carbohydrates and the fiber and the fats and everything is kind of mixed together the way God designed it.
In the proportions that only the Creator, its wisdom, can actually see the benefits and the reasons for. And so we're going to be looking at a diet that's a little different. It's actually high in carbohydrate, but that's not what you might have heard in the past when you heard higher carbohydrate. What do most people think about, George, when they hear high carbohydrate?
Well, even the scientific literature is a bit confused about it. When they say complex carbohydrate diet, generally what they're testing is actually starches that have been purified out of whole food and then fed to people. And indeed, those often enter the body more, well, they're refined. They come in quickly. They tend to cause problems. They don't have the fiber that the whole plant foods do.
So basically what you're saying is, when you hear a high carbohydrate diet, usually people are talking about white flour and refined sugar and just bagels and pasta and bread made out of refined flour.
Indeed, that's probably why people shied away from carbohydrates when diabetes was first understood to be a sugar problem. You see, carbohydrates go into the blood, they make the sugar go up. So it was rational, as we started to look at the disease, if you could lower the blood sugar, you'd actually fix the problem. Unfortunately, as they moved to diets high in protein and high in fat to try to bring the sugars down, it led to more problems. For example, kidney disease from too much of the protein. So this is kind of a new approach, but it's not new. It's really the old approach, isn't it?
Well, that's true. It is the old approach. It's the original approach. It's the creator's approach. And the people that heard about this at the American Dietetic Association meetings this year were just astounded. They couldn't believe what they were seeing. For what they were seeing is what you'll see here on this first graphic. What they were seeing is that patients in a 19-day program at the Lifestyle Center of America who had type 2 diabetes actually dropped their blood sugar significantly and actually I would say dramatically on a high carbohydrate total plant diet. And so it's kind of the opposite of what you would think would be effective for type 2 diabetes. In fact, most individuals think you need to be on a low carbohydrate diet in order to get the blood sugar down. But what we actually have seen and see every day at the Lifestyle Center of America is that blood sugar drops significantly on a high carbohydrate diet, as long as those carbohydrates are whole grains, beans, vegetables, and fruits, nuts, and seeds.
So that's really good news.
It is good news, and the best news, I think, about it is that not only is your blood sugar coming down, but those foods that you're eating are 80% water, and they're rich in fiber, and so what else tends to come down as your blood sugar is coming down?
Well, you know, when we take someone's blood sugar, it's like taking a black and white photo. You do the click, and you know what the blood sugar is right there. As physicians, we like to be able to tell a little more. We'd like to have a video of the blood sugars so we could actually see what happens through the day. That would be a lot nicer. It's not perfect, but we've come up with a couple tools. One of those tools that we've used is something called hemoglobin A1C. That is, it's the hemoglobin molecule in the blood which, as it's formed, has sugar attached to it. And we know that the amount of sugar attached to it is reflected by, reflects how high the blood sugars are. Well, in our program at Lifestyle Center of America, we have 19 days to check and see what difference is made.
And it takes about 3 months to see differences in hemoglobin A1C.
A1C takes longer, that's correct.
So actually, if you look at this data one more time, you'll actually see that what we used was not hemoglobin A1C, but something called fructosamine. And fructosamine is a similar arrangement, but it's not the hemoglobin protein, it's the albumin protein, another major blood protein, and it's the amount of albumin that is actually combined with blood sugar. And that you can see changes in about 2 weeks, and that's about the time between our first blood draw and our second blood draw. And so changes in fructosamine actually show that you're right, not just a fasting blood sugar today and a fasting blood sugar a week from now, but the trend of blood sugar over a 2-week period.
You know, folks may not have recognized on that slide, there was a little thing up in the corner that said P equals less than 0.001. What does that mean, Tim?
Well, actually, what that means is that the difference between the blood sugar, the fructosamine, in other words, the average blood sugar when they came into the program, versus the fructosamine level, or the average blood sugar as they departed from the program or left the program, was statistically different. In other words, there's less than 1 chance in 1,000 that the difference in these two blood sugar readings could be by chance. And so it validates that there was a real change.
We like to say as scientists, it's statistically significant.
That's right. Now, statistically significant doesn't always mean clinically significant. But I think you can agree with me, George, that when we look at our patients at the Lifestyle Center of America, we can see that truly their blood sugars are coming down, they feel better, and in fact, even insulin levels are coming down significantly in just a couple of weeks, which is also important.
That's good. Let's see, something else I think of. I think we have another slide that looks at weight loss, doesn't it? Does weight loss, or does weight come down as people go through this lifestyle change?
You know, one of the things that we tell our patients at the Lifestyle Center of America is don't focus on weight. Just focus on the health principles that the Creator has provided. The total plant diet, the walking program, the increase in water intake, spending 15 minutes in the sunlight at least 3 days a week, and getting adequate rest, opening the windows, get fresh air, move away from harmful substances like caffeine and alcohol and tobacco, and then spending time with your Creator. These are the things that the Creator would invite us to spend our time with and to focus on. And when you do that, you'll have a side effect, and that side effect is weight loss.
You mean I make a mistake if I just focus on my scales?
Well, yes, actually, it's probably better not to spend so much time looking at the scales. You might want to check it once a week. But the reality is that if you're too focused on your weight and your weight's not coming down as you might like it to, anxiety level can go up, stress level may go up, and it may actually increase the difficulty of losing weight. And so, but people follow weight, researchers follow weight, and so we like to follow it as well.
Well, that's an interesting way of looking at it, Tim. Weight loss is a side effect of the lifestyle treatment of diabetes. Usually we think of drugs having side effects and they're being negative, and here's a positive side effect.
It's a very positive side effect. In fact, researchers have shown that if you have tight blood sugar control, that you'll actually reduce your risk of blindness, retinopathy. If you have diabetes, you'll reduce your risk of kidney disease, nephropathy, your risk of nerve damage, neuropathy, and perhaps even heart disease if you have tight blood sugar control. But most of those studies show that the individuals that had the tight blood sugar control, their weight actually went up over time. And this is a very difficult problem in medicine today. Blood sugar going down, weight going up. And what this means is over time you're going to have more and more medicine to keep your sugar down.
Well, often people are focusing right on the sugar and give some insulin to bring the sugar down, and insulin tends to make people gain weight. Medication to increase the insulin tends to make people gain weight. So it just makes a lot more sense to treat the cause, to get the calories down, to use the plant-based diet to optimize calories, and then, of course, use the exercise as well. Well, don't we have a slide that shows something about the weight?
Yes, George, we do, and we'd like to get to that. And as we're moving to that data, we'd like to just remind you that the first slide showed that the blood sugar comes down on a high carbohydrate diet if it's whole grains, beans, vegetables, fruits, nuts, and seeds. This second slide will actually show that not only does the blood sugar come down, but the weight comes down. And in fact, it on average comes down about 10 pounds, as you can see here. And again, each one of the slides that you're going to see on this program, the difference between the parameter at the beginning of the program, weight in this case, and the parameter at the end of the program, 19-day program, is highly statistically significant. In fact, there's a less than 1 chance in 1,000 that the difference in weight here could be by chance. And so a 10-pound weight loss in just 19 days, that's a very significant thing. But the most important thing is that the insulin resistance that weight loss represents is a reduction. Insulin resistance lowered, smaller. And that means you're going to need less insulin or less medication if you have diabetes.
My, weight loss as a side effect. Isn't that fun?
Powerful.
Now, sometimes when we think about our weight, we focus on the scales. We step on them in the morning, you know, kind of exhale to get them to read a little bit lower and try to get them just right. But even more important than the weight is actually how much of the fat that we lose, right? Didn't we discover something about what happened to people's fat stores during the program as well?
Well, actually, we did, George. In fact, this was data coming from 5 consecutive programs at the Lifestyle Center of America about a year ago. These were all patients with type 2 diabetes. And what we see here is the percent body fat actually dropped significantly in just 19 days. And as you can see, it's highly statistically significant. And when you're reducing the body fat, you're actually reducing the resistance that the body has against insulin, which means you're not going to need as much medicine. You're not going to need as much to take as much insulin if you're on insulin. And it just means it's going to be easier to treat the condition of diabetes.
2% loss of body fat. Why, that's a pleasant sort of a thought. About 9.5 pounds worth of weight. My wife has this model. Maybe you've seen it. It's about 18 inches long and about 5 or 6 inches in diameter. That's supposed to be what 5 pounds of fat looks like. It just seems good to me to see that leaving, that fat leaving the body. It brings improvement to the physiology, doesn't it?
Absolutely. And in fact, in just a 3-month period, studies that combined about 1,800 calorie diet with 30 minutes of vigorous exercise 5 days a week actually showed, George, that you could remove about 25 to 30% of the fat in and around the organs of the abdomen in just that short period of time. And that means a lot less resistance to insulin, because resistance to insulin is often centered right in that fat that we carry in the midsection.
Well, that's right, Tim. But, you know, we've been focusing kind of on the diet part of this. It's important to eat those plants. But that was half the equation when we talked about treating the cause of the disease. And the other half of that equation is the exercise component. What have we learned about the exercise component?
Well, actually, if you want to dramatically increase your body's ability to take in blood sugar, just use your muscles. In fact, the muscles will wake up and respond to insulin almost immediately upon use. And so exercise, especially the big muscle groups, can dramatically lower the insulin resistance. It can lower the blood sugar level. In fact, at the Lifestyle Center of America, we see individuals who are taking insulin, and if they walk after a meal, like an hour, hour and a half, 2 hours after a meal, if they walk briskly, their blood sugar drops dramatically, and they actually have to cut back on the insulin that they're going to use at that previous meal if they're going to be doing vigorous exercise several hours later.
Another benefit from treating the cause rather than simply the symptoms.
Absolutely.
That's good. Well, how do we measure fitness?
Well, there's several ways to measure fitness. We use some simple methods at the Lifestyle Center. We actually measure resting heart rate. And, you know, if your resting heart rate drops significantly over a period of time, you know that your heart is more efficient at doing the work of carrying you through the day, and so it doesn't have to beat as often. And so we can actually see here that the resting heart rate dropped, again, significantly in just a 19-day program at the Lifestyle Center. And you can see it's highly statistically significant difference. Now, another method of measuring fitness that we use is simply looking at something called VO2 max. And we estimate this by doing a Rockport mile. VO2 max, George, what does this mean?
VO2 max is an interesting measurement. What it does is to actually take and measure how much oxygen you can take into your mouth, get into your lungs, to your heart, out to your muscles, use the oxygen, turn it into carbon dioxide, send it back to the lungs, and then breathe out. So it's a very good measure of fitness.
So it actually is showing us that individuals, if we can look at the graphic one last time, individuals who come to the program at the Lifestyle Center of America, they have a certain ability to take in and use oxygen. And at the end of the program, they have an even greater ability to use oxygen, and that means that they are more physically fit.
What's more than that, there's an improvement in their insulin sensitivity as well. That is, their disease is getting better as their fitness improves.
And so we see the validity of treating the underlying cause of the condition rather than just using medications to treat the symptoms. Now, Dr. Guthrie, there is a particular type of exercise that we like to use at the Lifestyle Center of America, and it actually intersperses a little bit of rest into your exercise program. Tell us more about this.
Oh, I really like this. You see, I've never really been able to exercise as well as I would like to. Kind of sore, it hurts afterwards. When I came to the Lifestyle Center of America about 2.5 years ago, why, I went to our fitness director and I said, "Show me what you do." So he put me on the treadmill and actually measured my VO2 max. Came out at 35 liters a minute. That's how much oxygen I could actually use, get into my muscles, burn, turn into carbon dioxide, and then exhale. Well, he looked at me and said, "George, you're in excellent health for a 65-year-old male." Well, that was a little bit discouraging. But then he explained to me how to do this intermittent training. You see, one of the things that is a problem for the body with exercise is something called lactic acid. Lactic acid is made when our muscles run out of oxygen to burn. And they end up making lactic acid instead, and lactic acid makes muscles hurt. It actually decreases our endorphins in our brain, so exercise is not nearly as fun. One of our mantras is every minute of exercise includes some rest, and you get credit for that rest. So each guest who comes to the Lifestyle Center of America has a fitness evaluation, is given a range to keep their heart rate in. They get the heart rate up, and then once it gets up, they let it come down. And that's that rest for each minute. Well, you know, when I did that for myself, someone who had never really been able to exercise before, keep consistent with it, my VO2 max, when it was measured about 10 weeks later, came out at 44.3, about a 27% increase. And I didn't hurt. It was something I could continue, and indeed it's something I continue to this day, 2.5 years later. The good news is that's what most of the people who come to Lifestyle Center have discovered. This kind of exercise, intermittent, with some rest and some exercise mixed together, getting credit for all of it as exercise, actually gets more benefit, is more pleasurable, and more something you can continue. To me, that's an exciting new perception, a new perspective on exercise. Now, since there's not so much lactic acid, there's not so much damage to the tissues, and people are actually getting better faster rather than having the damaging effects of the lactic acid.
And, George, the damaging effects of too much exercise on the joints and on the heart. And so it's not just the muscles that benefit, but also the joints can benefit. I remember when my wife Sylvia went through the program, the lifestyle program, and what she noticed is that prior to adopting the intermittent training, the mixing rest with exercise, you know, she would get very winded and just feel totally exhausted, you know, after 20, 30 minutes of exercise. But after she adopted the intermittent training style of exercise and let that heart rate come down about 10 beats and then pushed it up 10 beats and let it come down another 10 beats, that form of exercise, the intermittent training, allowed her to go for 30 minutes, and she did not feel winded. She felt that she could go for even longer. And so what it does is it takes away this exhausted feeling of people that exercise, and that's one of the reasons that individuals quit exercising. They hate this exhausted feeling. The truth is you don't have to have that exhausted feeling. And when your body is telling you you need to take a little break, do it, and you won't miss out on the benefits of exercise. In fact, a very wise health reformer a number of years ago suggested that those in sedentary occupations, such as physicians and pastors, should actually walk up and down hills. And when you think about it, George, that's a natural form of intermittent training. In fact, we might address this issue. Do you need a heart rate monitor in order to do intermittent training?
Well, I think it's probably helpful for those who are really sick and who might have a heart attack to keep them in their safe range. So, no, I don't know that you would have to, but I think it probably makes it a little easier. What about you?
So, well, you know, I've tried it both ways, and I think that there are advantages and disadvantages, but the message we want to send today is that if you use a heart rate monitor for intermittent training, that's an excellent way to do it. It's probably the most precise way. But if the cost is an issue, or if complexity is an issue, if you like a more simple approach, that's okay. Just walk up and down hills, or walk faster and then slow down, or some who are able might be able to do a little light jog and then walking. But whatever you do, walk or exercise most days of the week. This is very important at getting at the underlying cause of type 2 diabetes.
You know, Tim, one of the things that brings me the most pleasure as a physician now is watching people who come in with a cane or just hardly able to get around, sometimes a wheelchair, and have them come to me 2 weeks later and say, I just walked 2 miles. There is such pleasure in helping people get to the root cause of the disease rather than simply treating the symptoms, because they're actually getting better. They're feeling better. Their blood sugar numbers are coming down. As we pointed out, they have the weight loss side effect, and they're just feeling better inside. It's a really rewarding way to practice medicine.
And speaking of the inside, George, you know, individuals may watch a program like this and be asking the question in their minds, well, so I do all of these things, and maybe my blood sugar will come down, and maybe I'll live a couple of years longer. Is that really such a big deal? Is it worth the effort? And I think it's important to point out that probably the most important reason to adopt a total plant diet, to adopt an exercise program, to embrace all of the Creator's natural remedies, is for the benefit to the mind, the importance of clear thinking, the increase in the ability to carry on that daily devotional life and connect with our Creator. That's the ultimate and the most powerful reason for adopting these health principles. It's not just to keep your physician happy, but it's to have a better connection with your great physician.
That's right, Tim. As our bodies improve, our brains get clearer, the circulation to our brain is better, and we are better able to have a relationship with our Heavenly Father. Well, if we understand diabetes, type 2, to be a problem with too much energy in and not enough energy out, then I suppose it makes sense to treat the cause, not just the symptoms. It's best to exercise, eat a good diet. We are wonderfully made.